am Tina Paul, and I bring you greetings on the behalf of the Suffolk Alumnae chapter of Delta Sigma Theta Sorority Incorporated. I welcome you to the second session of our Black Health series. Today, we're going to focus on team health. So, welcome. We have three outstanding members of the medical health profession here to share information with you. They are also members of the Divine Nine. And so we hope that you find today's session to be extremely informative. Next, I would like to introduce to you a member of our chapter. Her name is LaGora Powell. Ms. Powell?
Good day, everyone. My name is LaGora Powell. I am a family practitioner, a physician assistant, and a member of the Suffolk Alumnae chapter of Delta Sigma Theta Sorority Incorporated. I will be serving as your moderator for today's event on Black Health Series Part 2, entitled Teen Health Summit. I am truly excited about today's event as this area in adolescent medicine has been near and dear to my heart for many years. I am not ashamed to say that during this time, I myself suffered with bad eating habits, obesity, and even anxiety. It's because of people that you'll be hearing from today and a close network of family and friends that I am here today. The panelists are experts in their respective fields. They are Virginia native, HBCU grads, members of the Great Divine Nine, and here today for the sole purpose of helping you to improve your physical and mental well-being. So let's jump right into our first speaker for today's event, Dr. LaGora Brooks. Dr. Brooks believed that pediatrics is the ultimate in preventive medicine. Dr. Brooks is a native of Henrico, Virginia, and serves as a pediatric provider with the Centera Network. Dr. Oliver Brooks, she is known from a very young age that her mission and purpose in life will be to work with adolescents and those children from the ages of birth to 22 years of age. Dr. Brooks is a graduate of Howard, the Virginia Commonwealth, and is a graduate of Howard Medical College. She has been working in the Virginia area since her practice started. She is a recipient of the National Health Service Corps, and for many years, she worked in an underserved area as a family practitioner on the Eastern Shore of Virginia. Currently, she works as a pediatrician in the Virginia Beach area, where she loves to be around her husband and her three daughters. I present to you Dr. Oliver Brooks. Dr. Brooks.
Happy Saturday, everyone. It is so nice to join you guys today and to be a part of this Teen Health Summit. I'm so excited to share with you with regards to adolescent medicine. Once again, I am Dr. LaGora Brooks. I'm from Henrico, Virginia, so not far from Virginia Beach where I practice today. And I am a board certified general pediatrician. All right. Let's move on to the next slide. Pediatrics is the practice of medicine from birth until your 22nd birthday. So it's basically from the cradle through college. And it certainly encompasses all of adolescence as well, which typically begins around the age of 10 to 11 years old and spans until your 22nd birthday. Some are now expanding pediatric practices even to 24. Next slide, please. So here we're going to just discuss developmental changes that we see in your body as you become an adolescent, as you move from your preteen to adolescent years. If we take a look starting over at the top right of the diagram, you will see a prepubescent or pre-adolescent girl with a very non-contoured chest, no breast buds or no protrusions at this point, and that is stage 1. We basically stage adolescent development in what we call Tanner staging. So it goes from 1 to 5, as you see detailed here. Please don't pay as close attention to the ages because it does not completely correlate. Typically by stage 2, young ladies or little girls will start to have what we call breast buds. That's about a 1 by 1 centimeter knot that you can notice under the nipple or along the chest. And oftentimes we get calls for appointments scheduled because parents say, my daughter's complaining that there's a knot on her chest and it really hurts her. So typically those knots are a little bit sore. When they come in, that's the opportunity once again to talk to them about development and discuss those things that are absolutely normal about this process. Typically we see this happen as young as 8 years old, and that is actual normal development, even though you see from this diagram that it says 10 to 11 years old. We can see it as young as 8 years old. And these ages do vary based on genetics and based on ethnicity. Oftentimes our black and brown young little girls begin to develop a little bit sooner, but that is to be expected because it is genetic as well. So then we move on to stage 3, or Tanner staging 3, where you can see on the diagram that there are breast buds, but then you start to see a little bit more of the breast tissue development around the breast buds as well. So the breasts start to become a little bit fuller, and we'll move on to the middle of the diagram too, where you see that now there begins more hair development. Typically from the age of 6, 7, 8 years old, you can see pubertal hairs, but that does not signal development. For girls, what we're watching for is breast development. Typically, by the beginning of breast development, you'll see a cycle 2 years after that. So back to stage 3, that's when we start to see consistently hair development in the lower regions, and that is usually about the age of 10, somewhere between 10 to 11 years old. Then we move on to stage 4, where there's fuller breast development, and then the hair distribution down lower begins to be more of a V distribution. Between stages 3 and 4, that's usually when a young lady will start her period. So we'll start to notice that they're having more normal periods, typically by stage 4 to stage 5. Now stage 5, as you can see, is a fully developed adult body type. So you're going to have your fully formed breast, and then you're going to have a pubertal hair distribution, which is in a triangular shape, but it can lead up to your lower abdomen and potentially towards your navel as well. So if we move to the left of the graph, you can see male development there, and as you notice, from stage 1, 2 to 3, there's not a huge difference in growth or penile size per se. Boys, we stage development by testicular and scrotal enlargement. So typically by stage 2, which is around 10 to 11 years old, we start to notice testicles are approximately 2 centimeters, and they begin to grow from there. So from stage 3 to 4, you have more growth and you start to develop more hair. And then by stage 5, you have a more normal, you have an adult distribution of hair, which is more full and coarse, can lead up to your lower abdomen and towards your navel. So I touched on it a little, but while heredity plays a large role in the timing of pubertal development, nutrition and exercise contribute greatly as well. And I do just want to mention here, for information's sake, oftentimes I have moms come in and say, I'm so surprised that my daughter didn't start at 11 because that's when I started my period. So I'm just waiting. The heredity for menses for little girls is actually more tied to paternal heredity. So it's very interesting, but I have 2 young daughters, and typically my daughters are going to start their pubertal development at and along the same stages that my husband's mother did or that my husband's sister did. It is not an easy way to think about it, but it's hereditary as well, but from the paternal side. Next slide, please. So, as far as adolescent nutrition is concerned, boys typically require approximately 2,800 calories per day, and girls typically require approximately 2,200 calories per day in order to continue to nourish their brains and their growth and just overall good health. Adolescence is a time of increased metabolism. So even with minimal activity, adolescents burn lots of calories and lots of fats. So we'll keep in mind that 3,500 calories equals 1 pound. And I bring that up because I often have teens come in and say, I don't have time for breakfast, or I don't enjoy breakfast. I don't eat breakfast because sometimes my stomach hurts in the morning and that kind of thing. Then we also have them say, sometimes I kind of forget to eat, so I haven't had the opportunity. And that shows us why it is that they're not gaining weight properly, or they're sometimes not as well nourished as they should be, because we have to be sure that we're pushing for those 2,800 calories for boys, 2,200 calories for girls. So let's move on and discuss some of the things we can do to maintain healthy nutrition. Next slide. All right, so here we're going to just break down some of the components of a healthy diet. You see that I have at the top proteins, carbohydrates, and fats. Proteins and carbohydrates are going to provide 4 calories per gram. As you can imagine, fats are going to provide twice that, so 9 calories per gram. 50% of our body weight is made of protein, and how we get protein in our diets is with meats, lean meats, and that is also going to include eggs and cheese, and also beans and nuts. So if you are vegetarian or in the vegan family, you want to make sure that you're getting plenty of beans and nut products to get the protein you need to help build muscle and support your nutrition and weight gain. As far as carbohydrates are concerned, carbohydrates are our body's fuel. That's the energy we use to get through a day, or when you break it down, there are complex carbohydrates and there are simple carbohydrates. So you have the good and you have the bad. Complex carbohydrates are going to provide sustained energy for us. So just as a visual, before you see a marathoner run their race, oftentimes their last meal or their last few meals are large bowls of pasta and that kind of thing, because that's going to help to provide the sustained energy they need to get through that 26 plus mile run and still be in a healthy state of nourishment. Simple carbohydrates include sugars and things that are going to just give you a burst of energy but then dissipate. And oftentimes the energy is so transient that you then are pretty fatigued thereafter. You also want to make sure you get a good healthy serving size of your breads, grains, and rices. So the one thing that is extremely important about consumption of these particular items is anything you're eating that's white, you want to do your best to change to brown. You want to move to whole wheat pastas and whole wheat breads and brown rice, because that increases the fiber in your diet, which helps you to pull off cholesterol, and it is just a much healthier way to eat. I want to encourage you guys, even with what we're talking about, to make sure that you're reading packages. Turn your package around and see what is in everything that you're reading. If it's not a fresh fruit or vegetable, you need to read the packaging and make sure that you're having only one serving size, and that is going to keep you from overeating or going past that 2,800 or 2,200 calories to the point that you're now adding an additional 3,500 calories a day, which is pounds. Okay, so we want to avoid that as well. Now we'll move on to our fats. Fats get a bad rap because it is important to have healthy fats in our diet, but you have to consume them in moderation. It's important to have healthy fats in our diet because they help us to absorb specific vitamins, namely the fat-soluble vitamins. So vitamin A is a vitamin that's going to help to sustain night vision and keep your eyes healthy. Vitamin D is going to help with calcium absorption and bone development. Vitamin E helps with skin and hair. It's also an antioxidant, so it's going to help to ward off infection. And vitamin K is important for clotting and for bone health as well. So it is important to get our fats, but you want to try to stay more with unsaturated fats, and that's going to be like avocado, avocado oils, olives, olive oil, that kind of thing for cooking. You don't want to have too much in the way of saturated fats, and I have cholesterol here highlighted so we can kind of transition back to proteins for a minute. Cholesterols come from the fats in meats, so that nice fatty cut of meat that has a bone to it and is soft and it is moist and that kind of thing is so full of cholesterol. And we have to be careful about that because cholesterol is going to build in your blood vessels and start to occlude them, which will cause your heart to have to beat much faster and harder, and it can put you at increased risk for high blood pressure, for heart attacks, and for strokes. Okay. It's without saying that it's important for us to be sure that we're consuming at least 3 to 4 vegetables and fruits a day as well. Next slide, please. Water, 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 water. Water is our life's vein. It is so important to drink at least 50 to 60 ounces of water a day. Water is going to help to cleanse your body. It's going to help to refresh your urinary tract and keep your kidneys functioning properly. Water also helps to aid in digestion, softening the food so that we can excrete it properly. If you don't drink water regularly, our bowel is made to actually suck water from food so that you can excrete just the waste that should be excreted. But if you're not drinking enough water, that can lead to problems with chronic constipation and other GI issues. So 50 to 60 ounces of water a day is an absolute must. Next slide, please. In addition to maintaining our health by doing that with healthy foods and with water, it's important that we exercise. Your heart is a muscle, and it's important that we exercise that muscle at least 30 to 45 minutes, 3 days a week outside of PE or whatever you do in school. I have lots of kids who come to me and say, yeah, I have PE this semester, so I have to do X, Y, and Z. You don't have to be a part of an organized sport or a team sport. You don't have to be on the track team, but you do need to walk the dog for 30 minutes, 30 to 45 minutes, or just take a brisk walk. Have a weighted jump rope and do that. We've got to figure out how to be creative and to stay active, because as we do that and stay active, we also help to keep our heart and our body healthy. All of these things that we discussed so far come together to give you a healthy body, which also helps to transition to healthy minds, healthy brains, and healthy psyche. So all of this is extremely important. Please work to get your 30 to 45 minutes of exercise in at least 3 days a week. Next slide, please. Now we'll move on to vaccinations. There are several vaccines that are required in adolescents, and it's extremely important that we vaccinate so that we can continue to stay healthy and keep these deadly diseases eradicated. So next slide, please. We'll discuss Tdap, meningitis vaccines, Menactra and Trumemba, and then Gardasil. These vaccines are all required in your adolescent period. Next slide, please. Tdap stands for tetanus, diphtheria, and pertussis. These vaccines actually begin in infancy. In infancy, they're called DTaP because there's a larger component of diphtheria in that vaccine. But if you're fully vaccinated, you would have received a DTaP at 2, 4, 6, and 15 months, and then we receive a booster at 4 to 5 years old, just prior to kindergarten. We repeat these vaccines, now the adult version, the Tdap, at at 11, and then we repeat them every 10 years thereafter. Tetanus and pertussis is important to vaccinate against because after approximately 7 to 10 years, our immunity wanes. So adolescents and adults are actually the carriers of pertussis. So pertussis for me is not going to be deadly because I'm relatively healthy otherwise, but it would cause me to have a chronic cough that would last 2 to 4 weeks, sometimes even longer. And thank goodness we're masked at this point in stores and restaurants and out in public, because an adult or a teen who carries pertussis and coughs as they walk past a mom holding her 6-week-old baby can cause great danger. For infants who have not been vaccinated against pertussis, it's very common to see full respiratory arrest. Pertussis can kill a baby, so it is extremely important that we vaccinate regularly. And I saw this quite often working on the Eastern Shore as a pediatrician. The Eastern Shore is an area with a large number of migrant workers, and oftentimes everyone is not completely vaccinated. So at least a couple times a year, there are infants who are rushed into the hospital. We know right away the issues that we need to address because they're not able to breathe after having contracted pertussis or whooping cough. Next slide, please. Next important vaccines are our meningitis vaccines, and we receive those at 11 as well. Typically, the Menactra vaccine covers about 3 different strains of meningitis. We receive that along with the Tdap before middle school, and this protects against the meningococcal bacteria, which causes or can cause an infection of the lining and the fluid around your brain. So it's important that we focus on this age group because adolescence is a time where we become a little more intense with team sports. We're in locker rooms, we're in close contact, and any kind of transfer of bodily fluids or saliva, any of that can increase our risk for contracting meningitis. So it's important to vaccinate at 11, and then we repeat that specific vaccine, so meningitis or Menactra, at 16. At 16, when we give the second Menactra, we also begin the first meningitis B vaccine, which in our area we give something called Trumemba. There's another vaccine called Bexsero, but the meningitis B we begin at 16, and there are 2 of those as well. They need to be at least 6 months apart. So typically, as it happens, we do the meningitis B at 16 and then repeat the second meningitis B at 17 at the next well check. Next slide, please. Lastly, the other vaccine that we give during adolescence is Gardasil. Gardasil is the vaccine for HPV, or the human papillomavirus. It protects against the 9 most virulent strains of human papillomavirus. This virus can cause cancers of it can cause oral, neck, throat, and genital cancers. HPV is caused by contact, or is spread by contact. And there has been lots of conversation about how it's spread and that it is more of a sexually transmitted disease. It can be spread that way, but we have parents approach all the time and say, I'm not really sure about this vaccine because I don't want to give my child permission to have sex, or I don't want to. They feel like it is in some way relative to sexual activity and absolute, but it is not. 8 out of 10 of us have been exposed to HPV, human papillomavirus. HPV is the virus that causes the warts on your toe, the warts on your finger. So I have this picture of the person standing barefoot because anytime you have a break in your skin, that allows for introduction of the HPV vaccine, or any other microbes for that matter. But this is how we get HPV. So that little boy who comes into my office and says, I had a wart on my finger, but I was chewing it and I bit it and now it's gone. Fast forward 40 years to that middle-aged or older man who now has throat cancer. we're finding that these cancers are caused by HPV. So it's not just about sexual contact. It's important to protect our kids, our adolescents from HPV, because we can prevent at least these 9 strains of HPV from causing cancer. What makes it even more crucial or critical for girls is that if there's a wart on your toe that hurts you, you come to the doctor, we talk about it. As we've watched it grow slowly, I can freeze it, I can shave it, we can do everything we can to remove it. But if there's a wart on your cervix, by the time you have symptoms and you come to us because you're concerned or we hear about it, it's late. It's pretty late, and you've been affected by disease. So this could affect your fertility in the future, or it could actually be cancerous, and you can die from. Many women die from cervical cancer. So this is a preventable cancer that we can vaccinate against, and it's important to vaccinate as early as possible. Our immune systems are much stronger when we're younger, so you get the benefit when you vaccinate at 11 versus waiting until you're 21 or 26 or something like that. So Gardasil is in a series of 2 vaccines if you begin them before 15. We like to have the vaccines done at 11 and 6 months later, so sometimes between 11 and 12, or if you don't start until 15, you have to have 3, and they're going to be 6 months apart as well. So you would have the first, then 2 months later you'd have the second, 6 months after the first you'd have the third. So that is Gardasil in a nutshell. Next slide, please. So we're back to where we started. Pediatrics is the ultimate in preventative medicine. And this is important because everything that we've discussed leads you to the point where if you are living healthy, if you are completely vaccinated and well, if you are eating healthy fruits and vegetables, making sure that you are reading serving sizes and staying within them, if you're drinking your 50 to 60 ounces of water a day and you're getting your exercise, you are set up for a great handoff to your family practice doctor and for a healthy life and ultimately healthy living thereafter. Next slide. I do believe this concludes my presentation, and I would like to thank you all so much, the Suffolk Alumnae Chapter of Delta Sigma Theta, for having me. I have enjoyed participating in your health forum, and I look forward to hearing the other speakers. Thank you very much.
Thank you, Dr. Brooks. I appreciate all that great information you provided us with. We do have a question portion coming up now. We have about 5 to 10 minutes to answer a couple of questions, and I do have some waiting for you, Dr. Brooks, okay? The first question I received: what are some recommendations for parents to maintain balanced nutrition for picky eaters?
In order to maintain balanced nutrition for picky eaters, it's really important to be as creative as possible. So oftentimes I encourage parents to involve their picky eater in meal choices. So you can provide different options and you say, listen, we shop together, we're going to cook these things together. So what do you want? Would you like to have spinach with Parmesan, or would you like to have broccoli? And it's okay to add condiments or different things for your picky eaters until they understand that vegetables are essential and they have to have them. The other thing I like to do is hide them in milkshakes and smoothies and that kind of thing. So you have to be really creative, mix your vegetables in together, allow your child to participate, and usually they do pretty well. And also you want to make sure that if you feel like they're not getting the nutrients they need, you want to add a daily multivitamin, because that will ensure, until we're able to have them eating better, that they're well nourished.
Thank you. And I have another question. Due to the longevity that you guys are seeing patients from baby up until 21, what if that child or young adult does not want to leave their pediatrician? How do we safely transition them on to somebody else? Or how much longer can you see them after that?
Yeah, and that is amazing, because that is what That's why I'm a pediatrician, because I get to grow with these families and just really kind of watch the kids to the point that we just love each other. And, you know, I hate for them to leave too. But so I've been practicing for 15 years now. I started out on the Eastern Shore, and some of my kids at the time may have been 10 or 11 or whatever. And you know what? 15 years later, I would see them until they were 21 or so. Now they're in their 30s and have had their own children, and they actually bring their kids to me. But for those who don't want to transition, there's some amazing family practice doctors as well. And what I do typically is refer my young adults to some of my best friends in family practice who are in the area. So that really helps. So you can ask your doctor to give you recommendations so that maybe they can move on to a family doctor who is similar in personality, maybe, or in, you know, in relation to you. That's one of the easiest ways to segue. But the longest I've seen a patient is probably to about 24 or 25.
I understand. Thank you so much. And we have one last question for you.
Mm-hmm.
And this one is, do you recommend carbonated or flavored water for children?
No, not necessarily. But if you can't get them to drink water any other way, then it's okay to flavor it a little. Maybe you could use Crystal Light or one of those flavorings. But as much as we can get them to just drink plain water, that's the most important or the best recommendation.
Dr. Brooks, thank you so much for that information. And if there are any other questions, please forward them to us at sacdst.org, and we will make sure we get those to her. Again, thank you, Dr. Brooks. I'm going to pass it back to Ms. Powell so she can go ahead and introduce our next speaker.
Thank you, Dr. Brooks, for all the wonderful knowledge and wisdom that you have shared with us, especially on the importance of proper nutrition, staying up to date on vaccination, and overall health. Next up, I bring before you Dr. Noah Wallace. Dr. Wallace is a man of faith and service. He is currently a major in the United States Air Force and is a family medicine physician who proudly managed the care of active duty dependents and retirees of all age groups. He attended Hampton University for college and then went on to attend medical school at the Virginia College of Osteopathic Medicine. He then completed a 3-year residency in family medicine in Danville, Virginia. Dr. Wallace has a passion for mentorship and guiding aspiring high school and college students into becoming healthcare professionals. He also spends time outside of work to engage in community service with his illustrious fraternity, Omega Psi Incorporated. He is happily married with 3 amazing children. Real quickly, before I turn it over to Dr. Wallace, I just want everyone just to go into our comment section and give Dr. Wallace a happy birthday shout out. Yes, today is his birthday, and he found it such a great opportunity to come on today and share with you this valuable information that he changed some of his plans. So without further ado, I present to you Dr. Wallace.
Good afternoon, everyone. Thank you so much, PA Powell. For those listening, I will also add that PA Powell and I are both colleagues here at Langley Air Force Base, where I am currently employed. So this is truly a phenomenal opportunity to share what I feel is a phenomenal topic that is pretty much like a revolving door when we are in our adolescence and youth. The topic of sexually transmitted diseases is very popular, and I think it also a very crucial topic for both adolescents and parents at that time to converse about and to be well informed on. So I'm thankful for this opportunity. Next slide. So just a brief disclaimer, in most presentations such as these, I just want to make it clear that the information being provided to you is to be construed as educational and informational, not to be considered medical advice. So although I am a primary care physician, I am not your doctor, so I just want you to be aware that the information is I try to present this information as accurate as possible, but you should not rely on it solely as to, my professional advice, and to always consult your own healthcare professional or pediatrician for circumstances prior to making any medical decisions. Next slide. So what my overall aim and hope is that you take away from this presentation is a deeper understanding of the following: a definition about sexually transmitted diseases, knowing the risk factors and conditions that can increase your risk for developing STDs. I will provide a list of the common STDs in the world currently, and then I will present the little bit more deeper information and elaborate on common STDs seen in the youth and adolescent age. We'll discuss routes of transmitting STDs, ways that you can prevent contracting a sexually transmitted disease, and then testing methods and treatment available for STDs. And then I will have the floor available for questions. Next slide. So I just want to open this presentation with a video. It is about 5 minutes, but I think it will hopefully provide a good inform you as we continue forward with the rest of the material.
I'm not in a monogamous relationship, and I just want to make sure that I'm protecting myself.
I don't have a boyfriend, but I do sometimes see someone I like. I like boys and girls, but I'm not sexually active.
Because I'm sexually active, I get myself tested every 3 months.
I think your doctor is a good person to talk to about sexual health because they can help you as far as doing an assessment of your risk. Your doctor can be a partner in your journey during your teenage years. It's the physician's responsibility to make sure that we take a complete and comprehensive sexual history on all patients. But for teenagers, I do it with every visit. I say, is everything okay? Do we have any needs in regards to sexual health?
Sexual health is about having a positive and respectful and responsible approach to sexuality and relationships. You can't tell if your partner has an STD just by looking at them. Most STDs don't have any symptoms, so a good way to have a safe and healthy sexual relationship is to go with your partner and get tested before you have sex.
A sexually transmitted disease can be passed on from one person to the next through any type of sexual contact, typically penile, vaginal sexual contact, or it may be even passed on through skin-to-skin contact.
I know sometimes people feel that oral sex is much safer, but you still can contract STDs that way as well.
STDs from oral sex?
Yes.
The person at risk for getting a sexually transmissible infection is anybody who has unprotected sex. We try to, first of all, encourage young people not to have sex.
But for those who choose to have sex, ways to prevent STDs are going to be to use condoms. Amongst teenagers, that's a very common method. But not only using a condom, but knowing how to use the condom.
I had had a sexual experience with my first partner, and I was like, I need to tell the doctor, and I know they're gonna ask if it was with a female or male, and I need to be honest. It was scary. My doctor was very cool. She calmed me down. She was like, it's all right. I see that kind of thing all the time.
So when was the last time you had sex?
It was about a month ago.
Okay. And do you have sex with males, females, or both?
Males.
Okay. And it's important at the onset of the relationship with the patient to tell them that I know that things may be embarrassing. I'm going to meet you where you are, as you are, and appreciate that.
When I went to a general checkup for my doctor, it was the first time I asked about sex. So I was nervous about asking, and the reason I asked was because I was very curious. She asked if I was sexually active, if I was dating a boy or a girl, and I said I am not currently sexually active. I like boys and girls, but I do not have a boyfriend or girlfriend.
I teach physicians all the time about being as non-judgmental as possible, especially when you're talking about sex.
When I spoke to my doctor, I had a negative experience. I had a new partner and we used protection, but I developed like a rash and I just felt like I should go get it checked out. And she looked at it and she said, if it looks like a duck and it quacks like a duck, then it's probably a duck. And I just felt like that was really inappropriate. Like I left the appointment crying because I was so upset. And finally, they called me back to get my actual results, and they were negative.
If your doctor is judgmental when you bring it up, then you really need to think about if that is the provider for you. When I go into the room, I say everything that we're going to talk about in this room once the parent or guardian steps out is confidential, unless I think that you're going to harm yourself or others. I encourage all physicians to have policies that are posted in their office to talk about what are the confidentiality issues.
Confidentiality is really important because I know that if I were to be having sex and my mom was informed, I would be like, I'm never going to talk to you ever again. So there has to be trust.
If anyone finds it hard to talk about sexual health with their parents, then they should definitely talk to a doctor.
Now when I talk to my doctor about sexual health, I really don't have a problem with it because I developed a good relationship with my doctor.
Learning about sexual health and the issues around it make it easier to talk to a partner or partners. The more you talk about it, the more comfortable you get talking about sex. So you can say, no, that's gonna put us at risk for HIV, herpes, gonorrhea, chlamydia, syphilis. So let's not do that, let's do this instead.
As a young person, you have the right to talk to your healthcare provider about your sexual health. You don't have to be embarrassed. Your provider can help you figure out for which STDs you need to be tested and also help you figure out how to protect yourself against getting STDs.
You need to talk to a person who is experienced in health. It's like, duh.
All right, thank you very much. So some very vital information coming from that video, which you may have witnessed as a very essential aspect in being able to have a patient who is of adolescent age be honest about their sexual identity, their sexual health. It begins with trust. And as a primary care provider, that is what I try to strive in each encounter I go into with an adolescent. I want to open the floor with reassuring them that the conversation that we have is confidential. Oftentimes it will be with the parent having left the room at the polite request of the doctor. And so that allows for more honesty about providing safe sex practices and counseling on STDs. So this is a scenario where I feel it's always important to sort of make a relatable case. The name of the patient has been replaced for confidentiality, but this was a case that I had a few months back. And so I'll read the scenario. Next slide, please. All right, so sorry if this has a lot of words on it, but I'll just read along. So John is a 16-year-old African-American male who comes into the doctor's office with his parents for a routine checkup. He is doing great since his last checkup a year ago and has no new health concerns. Towards the middle of the exam, the doctor politely requests that John's parents leave the office to gather detailed information about John's personal and sexual development. The doctor reassures John that the discussion between them is confidential and only John decides what information can be shared with his parents. John then reveals that he has a girlfriend and has thought about engaging in sexual activity with her. He wants to be educated about sexually transmitted diseases and safe sex practices. Next slide. So, at the very basic, a definition of sexually transmitted diseases is that these are diseases in the form of a bacteria, a virus, or even a parasite that can pass from one person to another through sexual contact. I've emphasized sexual contact in red font to remind you that this does not have to just be through vaginal or penile intercourse. It can be through oral intercourse or anal intercourse, or even the exchange of fluids through kissing. Next slide. Some of the common risk factors that adolescents may be at risk for developing STDs can include beginning sexual activity at a very early age, deciding against condom use, or maybe having not had the knowledge about condoms and just automatically engaging in unprotected sexual intercourse, having multiple partners, having a past history of STDs in oneself or their partners. If there is drug use or engagement in alcohol, these are certainly conditions where a adolescent state of mind can be impaired. And so the decision making is altered, and there leaves the room for risk for not only just sexual relations, but even the type of the nature of the sexual relation. It could be through a traumatic event, and something that was not at the consent of the partner. So that is certainly a condition that has to be addressed shared with the patient during the encounter. Dropping out of high school, and even teenage pregnancy. Next slide. So as I said earlier in the definition, STDs do comprise both bacterial, viral, and even parasitic forms. The bacterial versions of STDs consist of chlamydia, gonorrhea, syphilis, and chancroid. The viral forms can be herpes simplex, otherwise by the popular name herpes, genital warts, which was shared earlier about HPV. There are, again, common strains associated with the sexually transmitted type of HPV, hepatitis A, B, or C, and then HIV. And then the next slide, please. And on to parasites. These consist of trichomonas, pubic lice, which goes by the more common name crabs, or scabies. Next slide, please. Chlamydia is the most common bacterial STD in the United States. Patients typically will show signs or symptoms when they are seeking treatment or they are coming to my office. Oftentimes, the most common complaint will be penile or even vaginal discharge. That can take on various colors, but the most common color associated is typically a yellowish texture. There will be pain in the testicle or scrotum or even around the vagina. There may be intense bladder and or stomach pain and pain with urination. The common ways that we will test for chlamydia is through the urine. You may come to your doctor's office and expect to undergo what is called a pelvic exam. And because of the nature of that exam being very privatized and very intrusive, we always, as providers, will have a chaperone in the room to assist so that the patient feels comfortable, that there's no possible way that it could be misconstrued, that this exam is not at their consent. We can also test for it by taking swabs of the back of the throat or even in the anus if you are engaged in oral intercourse or anal intercourse. Treatment is available in the form of antibiotics to take care of chlamydia, and chlamydia is an STD that is curable. It is very vital that if you feel that you may have contracted an STD, or if you go to the doctors and are diagnosed as positive for chlamydia, then it is important to notify all sexual partners as soon as possible to reduce spreading the STD to new partners. And next slide. So gonorrhea is the second most common STD, and again, is a type of bacterial STD. Signs and symptoms here would include patients who might complain of yellowish green appearing vaginal or penile discharge. Like chlamydia, there can be pain with urination. There may be discrepancies in the period or menstrual cycle. And there can also be severe pain occurring during the act of sexual intercourse. The testing methods are similar through the urine. We can test the urethra. There will be a pelvic exam done and a swab can be taken of the cervix. or the vagina, and as well, there can be swabs collected of the throat and the anus. Treatment does consist of antibiotic medicine, and gonorrhea, like chlamydia, is curable. And I try to just reinforce the importance of, if you feel that you may have contracted an STD, or you find out that you were positive and you received treatment, then it's equally imperative to notify your partners who you might have engaged in relations with about this information. Next slide, please. Syphilis is a bacterial STD that once was considered more common in a distant past, almost more so in the 1950s through even the 70s. There was hardly much of it discussed in the earlier millennium. However, we have seen a growing number of cases return, even here in the Tidewater area, at times at the office, or in my part-time job, the urgent care where I work at. We have seen an increasing number of cases of syphilis being diagnosed. We tend to see it affecting the homosexual population more, individuals who share IV drugs through the use of sharing needles, or individuals who are engaged in high-risk behaviors and have multiple sexual partners. The signs and symptoms would consist of noticing an ulcer around the outer part of the vagina, or even on the penis, that then a few weeks later can manifest as fevers, swollen glands on the neck, or even around the pubic region, a rash that develops on the palms and the soles. The primary method of testing for syphilis is through the blood. And the treatment for it is using an antibiotic medication. It is curable, and you should know that if you are found to be positive, your case has to be reported to state health departments, and all possible sexual partners with the positive case will be evaluated. Next slide. Now, herpes simplex virus is different from the previous 3 STDs in that it is a virus, and there are 2 different types, HSV1 and HSV2. It used to be thought of that HSV type 1 was only responsible for causing oral, or what is commonly called cold sores, and that HSV2 was responsible for the sexually transmitted form, more commonly known as genital herpes. Later research, however, has shown that actually the 2 do overlap, and that through sexual intercourse, one can contract HSV type 1, and then through oral exchange of fluids, HSV2 can be contracted. It is most prevalent during teenage years, and the reason for that is because herpes simplex virus can be passed from one person to another, and you don't have to show any symptoms. You can actually share fluids with someone if you're sharing a drink, if you are engaged in, again, drug use and you're sharing drugs with each other. That is a vehicle for transmitting herpes. If you do find that you may be developing an outbreak and having active symptoms, what you will likely notice is on either the penis or the vagina, there's a cluster of grape, or tiny fluid-filled vesicles that are on the genital area. These can also appear on the mouth or around the anus, and they are very painful at first, but within a few weeks, they will start to disappear. And if it goes untreated, you will start to develop, again, fevers, swollen glands in the groin or the neck. And again, just want to highlight that people can be infected and not have any symptoms at all. And that's why there is such a high rate of transmitting herpes simplex virus. We test it through either taking your blood, or we will, if you are having an active outbreak and you have lesions on the penis or the vagina, we will get an actual culture and do that through the lab. The treatment consists of antiviral medication. Earlier, I said antibiotic, but because this is a virus, the medication that is used to treat an active outbreak is an antiviral medication. And the Important thing to note is that herpes simplex virus does not leave the body. It is not curable. What happens is throughout your lifetime, most of the time, this virus will lay dormant in your body. And it is not until you might develop an illness or some stress happens to your body that you develop an actual outbreak. Next slide, please. So Dr. Brooks did a phenomenal job of discussing this in her presentation. I want to just piggyback and foot stomp that HPV, while it can be transmitted through non-sexual means, through sexual contact, it is the virus that is responsible for causing genital warts. But we do the better part of trying to encourage for vaccination so that teenagers and adolescents are prevented from developing future risk of throat cancer, cervical cancer, and anal cancer. Through primary prevention, both male and females ages 9 to 26 years of age can receive the Gardasil 9 vaccine that Dr. Brooks talked about phenomenally. Women, what is very important is that the starting age of 21, a pap smear is performed every 3 years at your doctor's visits. And this is usually done in the form of a pelvic exam, and a swab is collected of the cervix, and that swab is then sent to a lab and processed under a microscope where the doctor is evaluating to see if there's any changes or potential changes that look like cancer. There currently doesn't exist a screening method for men, and so it's equally imperative and important to make young males and teenage males aware of the availability of the vaccine. There is treatments available for warts if you should develop them through the use of skin medications. And as Dr. Brooks mentioned, there are other methods for removing them with the use of freezing therapy and other methods. And once or unfortunately, if cervical or anal cancer should be diagnosed and there's evidence of it, then you will be coordinated and your care will be coordinated with an oncologist who is a doctor who specializes in cancers. Next slide. So HIV, human immunodeficiency virus, has received a lot of attention in the last 20 decades. Certainly, we know that HIV is discussed as a virus that has significant health complications associated with it. It is transmitted through sexual contact or the sharing of contaminated needles. It also, I should note that during a pregnancy, if a pregnant mother has not received proper treatment and is not aware that she may be infected, she can pass it along to her child. Teenagers often do not know that they have it because there's often a long period between being exposed to it and then actually developing what's called AIDS, which is the very advanced case of human immunodeficiency virus. I highlight here that the common population or demographic of people that are affected with HIV tend to be seen more in homosexual communities, those individuals who may have been infected in the past with STD, individuals who choose not to use condom use during sexual relations, if there are anal sex practices, IV drug abuse, or even victims of sexual abuse. The CDC does recommend that at least once throughout a teenager's lifetime, a full STD testing should be done and include HIV testing. And the method of testing is through a blood sample. Signs and symptoms here will often consist of unexplained fevers, significant loss of weight, and even frequent throat infections. Ulcers of the mouth can also be seen. Next slide. Currently, there does exist for individuals or teenagers who may be in the high-risk category, a pre-exposure medication that can be discussed with your general pediatrician if you desire. The treatment approach for treating HIV is usually involving different or multiple team of doctors And so it's very extensive, but if you should find that you are diagnosed with HIV, a very coordinated system of care starts the process for ensuring that you are properly treated. And there is no cure currently for HIV. Next slide, please. So again, CRABS is a more or less familiar term passed around. Because of the nature of this type of STD, it is often a parasite or a bug, pubic lice, it's more commonly known as, where the infested bug can latch on to pubic hair. And so during sexual activity where there is contact with the hair that may contain the parasite, it can transfer from person to person. So in ways to prevent contracting CRABS or pubic lice, we stress highly skin hygiene, making sure there's frequent washing and drying of your clothes and the bedding that you sleep on. Treatment does exist in the form of a prescription strength lotion or shampoo that can clear the infestation if one should be positive. And we often will identify during a doctor's visit with the use of a microscope, we can see the CRABS or the pubic lice on the pubic hair of the patients. It is curable, I should note. Next slide, please. So as was explained in the earlier slides, the most common routes of STD transmission is through your blood, through the skin, through the saliva, and through the semen. So these are 4 routes in which STDs can be passed from one individual to another. Next slide. So coming back to our case, and it's certain that at times when you're in the room with an adolescent teenager sharing a ton of information about their sexual health, sometimes it can be overwhelming for the patient. So what I would say here is that typically about midway in between my discussion with the patients, I do try to ask if they have any questions, or am I giving them more than they can grasp at the time? And oftentimes I also make sure that I'm writing down or I leave them with a handout about what we discussed. So I'm just going to read kind of the final through. After a thorough discussion about STDs, John is grateful to have a better understanding of these diseases and the other factors that could put him at risk for getting them. The doctor reminds John that abstinence from sex until adulthood is the most effective way to prevent STDs. He tells John that his social circle should never dictate or control his sexual behavior. Finally, John is reminded of the benefits of using condoms in all forms of sexual activity if he decides to experiment. John obtains full STD testing at the conclusion of his visit and states that he will ask his girlfriend to do the same. The doctor provides a list of resources that John can use to further his sexual education. And John is scheduled to see the doctor again in 1 year for his routine checkup. Next slide. So I've provided here a list of resources. The CDC is a vital source for sexual health information and STDs in adolescents. There is a STD information and referrals to STD clinics site that you can visit through the CDC, and you can call that number, and even an individual will connect you with a area or clinics in your region or geographic location to be tested for STDs. And then there's girlshealth.gov, healthfinder.gov, and American Sexual Health Association. So these are not all inclusive. There are, again, a ton of other valuable resources that can be explored. But prior to even visiting these resources, another great asset to you being continually informed about your sexual health is routinely going to see your pediatrician or your family medical doctor. And especially if there is already a trust and a good relationship professionally established with that doctor, that will allow for more open and honest conversations and allow for you to be very well informed if you should decide to engage in sexual practices. Next slide. So my take-home points from this discussion are that sexual health and identity is very important to your personal development. I think both parents and adolescent children should have an honest and open conversation, as well as adolescents, if you are in a relationship right now, having honest and open conversations with your partners about sexual orientation and health, and making informed decisions before deciding to start engaging in sexual relations. Making sure that you establish your no's and your yes boundaries with sexual partners. We are not mind readers, and oftentimes body language can convey the wrong information, but it is always important to make it known where the line is drawn for your sexual health, and what you may be willing to consent to, but consent is very important. Be careful not to associate safe sex practices with what you're seeing on social media. I do know heavily, I have a 16-year-old who it's hard for him to look up off of his screen when he's on TikTok, Facebook, Instagram, you name it. But it is equally important for parents to be safety inspectors and to routinely or about quarterly check your adolescent's phone and just have that safe space or that honest space. And I wouldn't say force yourself to take their phone, but have the discussion to at least see if your child is willing to share their phone and the reasons, and explain why you want to see their phone. Make sure your personal doctor takes the time to discuss ways to protect your sexual health. So you should never see or feel rushed in a room with your doctor. If the doctor is not giving you the attention you feel like you are deserved, then I think it's worth a discussion about finding a doctor who is willing to give you the space and always allowing you to have your questions answered and your concerns heard, for both parents in the room with the patient or even when you are in a room with your pediatrician by yourself. Next slide. Again, these are just my references that I used for this presentation. Again, a lot of my information came from the Centers for Disease Control. And then this was a book that was used, and go on to the next slide. And so that concludes my presentation. I'm very grateful again to the Suffolk Alumni Chapter of Delta Sigma Theta for this opportunity. And I am now an open book for any questions.
Thank you so much, Dr. Wallace. I will go ahead, and I have a couple questions that were sent directly to me. The first one I have, at what age can a child / young adult come in on their own if there is a suspicion of STD? And how do they also pick up medications in confidence and while confident, not sharing with their parents, excuse me?
So it's important to know that actually at even 13, I believe 12, a child who is seeking care for sexually related purposes, who may be wanting to undergo evaluation, has the right to withhold that information from being shared with their parents. And this is another key point where it's important for the healthcare provider to have that discussion, sometimes with parents not in the room. And that's usually with most of my encounters. I make it actually routine and as a part of an adolescent screening to politely ask the parents if they're willing, and most parents are receptive to it, to leave the room, as I do gather more information about why my adolescent patient is here, if they have any concerns for their sexual health, do they want to be tested, and if they do, that they can choose to accept that, and that information can remain confidential between you and the patient. And I don't know if that answered the second question. If you could repeat that again,
Oh, I'm sorry. The second part was, how would they maybe pick up their medications without informing parents?
So typically, yeah. So I will have often received before the patient leaves the room, a contact number that they choose that they would like to be communicated on, so that I or my nurse will contact that patient if there is any positive results that come back after we've done testing. And then we will also notify them through the phone or the contact information they've provided, where they can receive treatment. And that's usually at the pharmacy. But yes, there are ways about doing it. I will also say that there's another method through my urgent care. What we often do is, before we go into an encounter, there's a confidential information sheet that prints out, that we make sure the mailing address or the cell phone or mobile phone that has been provided to us is verified with the patient in the room. And if they confirm that that's their address and that's the mobile or the contact information they would like to be notified on, we will use that as a means to make sure that information is being shared directly to them about testing or positive results, or even where they can get treatment.
All right, and I'm going to conclude us with this last question. It says, how soon after unprotected sex can someone get tested?
Immediately, within hours of the intercourse or of the episode, because sometimes the potential for an STD can already be existing or be happening at the time that there's been unprotected intercourse. So there is no timing or defined time for when an individual wants to be tested for STDs. I would say that comes back to the importance of screening and being tested before there's even been intercourse. But if you should be engaged in intercourse before you've gotten tested, then taking any opportunity to come in after that time is always available.
Thank you so much, Dr. Wallace. We appreciate your presentation and all that information. Thank you.
Thank you very much.
I'm going to pass it back to Ms. Powell to introduce our last speaker for the event today.
Thank you, Dr. Wallace, for informing our audience on STDs. I know that topics on sex and STDs can sometimes be taboo in our culture, but the fact of the matter is that most kids learn about sex very early. Therefore, it's important that as providers and parents that we make sure that they get the correct information, not what they hear from TV or from their peers. Dr. Wallace definitely brought up some very important points throughout his presentation, definitely being about confidentiality and giving teens that opportunity to express themselves without a parent present. So parents, don't be offended when we ask you to leave the room for a few minutes. Understand that provides two things. One, it provides your child to have that honest and open relationship with their provider. And kind of going back to a previous question for Dr. Brooks, it also helps to teach them on the appropriate questions to ask and taking control of their healthcare. Because at some point at age 21 and 22, they're going to be transitioning out of pediatrics into a family practice or with an adult provider. So please understand that. And lastly, also just to point out something that Dr. Wallace talked about is that as teens and adolescents, you do have rights. Under the age of 18, you're able to be seen alone without a parent for anything related to STD testing or family planning, such as birth control options. While abstinence is the best practice, it's always better to be proactive than to be reactive. So definitely keep that in mind, okay? So we'll round out today's discussion with our final panelist, Ms. Ameka Lee-Graham. She is a licensed practice social worker with the Associate Counselors at Tidewater, Newport News, Virginia. She graduated from Norfolk State University and received her Master's of Social Work in 2007 from the Ethan R. Strong School of Social Work. She has been practicing in the community for over 14 years. She specialized in working with individuals with mood disorders. She resides in Hampton, Virginia with her 2 daughters. Ameka enjoys mindful nature walks and spending quality time with family. So I'll be turning it over to Ms. Lee-Graham. Thank you.
Good afternoon, everyone. I have been wonderfully enjoying both of the 2 panelists' talks. I have taken great notes because I have a 19-year-old and a 14-year-old. So thank you both for the wonderful information. It is definitely needed in our community. And so today I have the pleasure to talk about a topic that is so dear to me, teens and mental health, and also our 11 through 18, that entire population, to talk about the topic of it's okay to say, I'm not okay. And so I wanted to start by saying that, next slide, please. The first thing that I want to share is about self-awareness. It is so important for our young, our children, 11 through 18, to understand who they are, even though it's an ongoing process. But it's important for them to define for themselves, who am I? Am I silly? I'm smart. I'm introverted. I'm extroverted. I'm social. And I tell my children that it's important for them to be able to understand how they influence the world and how the world influences them, to truly understand themselves, because it is an ongoing life process, to truly know who you are. Next slide. So, what is stress and how may I manage it? And it's so important. So, stress is the degree in which we feel overwhelmed and we feel unable to cope with the pressures that seem unmanageable to us. And let me say out loud, and I hope my parents can hear me, our children do feel stress. This pandemic, even before the pandemic, but surely now, since we have been in this pandemic with COVID-19, please know that our children feel the effects of and I want to share with my parents, it is seek to understand our children. We cannot just say, oh, your feelings, oh, you're young, you shouldn't be sad or you shouldn't be this. Do not say that, because then it's going to close them off and they're not going to want to talk to us. It's a normal, it's going to magic wand that I could make everyone's stress disappear, but I cannot. Stress is going to happen. And so stress is a feeling of both emotional and physical tension. So there's some emotional things that happen and physical. So what does stress look like emotionally? It may look like feeling stuck for a child or a teenager, shutting down emotionally, being really sad, feeling hopeless, feeling unmotivated, and as well as feeling depressed. Emotional signs of stress can be having a headache. And my doctor says all the time, he says sometimes people have tension headaches, and that's because of stress. Stomach aches can happen. Having some back pain can happen. Nausea, chest pains, having a racing heart, having a racing heartbeat. All of those can be signs that a person is feeling very stressed. And so what can trigger stress? Stress is different for everybody. And yes, our teenagers and our children can feel stress. It can be, with this pandemic that's going on, the loss of loved ones, hearing about someone that has passed away, hearing that someone is sick, having a parent in the home that is sick, and they're afraid that, if I go to school, what if I come home and and my mom gets sick because I bring COVID in the house, I bring the virus in the house. Kids worry about us, and kids worry about what's going on in the world. So we really need to sit down and have those conversations, as both doctors have stated before, having those conversations with our kids to let them know, I validate you, I see you, and I'm here to help. I'm a part of your village. I'm a part of your support system. Next slide, please. Stress management, help is on the way. And so oftentimes, Ameka, what can I do? I'm feeling stressed out. What can I do? One of the things that I tell my clients and my teens that is very helpful, self-care is key to managing your stress. So what is self-care? Self-care is comprised of a wide variety of activities and tasks to help us take care of our overall wellness. So being kind to ourselves and self-love in action is key. And as this wonderful quote by our former First Lady, Eleanor Roosevelt states, friendship with oneself is all important, because without it, one cannot be friends with anyone else in the world. So I tell my clients, we have to be our own best friends. So if you were giving advice to your best friend, what would you say? Would you tell them something very negative? Would you say things, that would possibly hurt their feelings? And they all tell me, no, I would never do that. I said, then why do we do it to, why do you do it to yourself? And they look at me like, yeah, I guess you're right. So I challenge those negative thoughts and just help them understand that you got to be your own best friend. You can't talk to yourself the way, very negatively, because you wouldn't talk to someone else that way, who you hold dear. All righty, next slide, please. Okay, so this list is just some of the forms of self-care. Please know there are so many, and it really depends on what the person likes. Some people love to run. I'm a walker, so it depends on what do you enjoy doing. I love my cup of tea. I have to drink at least 2 cups of oolong tea a day, and I put it in my favorite mug because it just makes me happy to see Wonder Woman. So it just depends on what does it for you. Some of my children, I have a client, oh my goodness, she is a 14-year-old Picasso. I declare it. I told her mother to get her work appraised because it looks like it's worth a lot of money. So for her stress, when she's stressed out, she paints. Some people need quiet time. And I want to stress down below. I know our doctor stated about being mindful that our parents, we need to be mindful of what our children watch and look at on social media. I would even say not only that, but we also need to tell our kids, do a social media detox sometimes. And even us grown people, I'm guilty. I too need to do some social media detoxing because sometimes our children, and sometimes we are too, we can be so attached to our phones and to social media that it robs us of being present with what's going on around us. So even if it's a one day or a weekend detox, I would encourage to just have kids put the phone down for a day or so and see how life goes. All righty, next slide, please. Okay, there are 5 self-care domains. And I do also have a self-care wheel that talks about their 6 domains, but just in case we don't have that handout available, I'm going to talk about the 5 because I'm going to incorporate the 6th one into this presentation. So there's 5 ways that we can really take care of ourselves, and we need to be balanced and practice these areas every single day. So we have physical self-care, as both the doctors talked about before, getting regular medical care. Eating healthy, exercising is so important. Getting enough sleep. Sleep is very important. One that I didn't put in here, drinking water, is very important too. Taking a walk, getting off the cell phone, and getting some me time. All of those, plus there's others that incorporate physical self-care that you need to be engaged with every day. Secondly, there's emotional self-care. So there's ways that we need to use some affirmation statements. What are we saying to ourselves about ourselves? Is very important. How are you loving on yourself? Are you taking time to be still? Sometimes we need some self-reflection time, just to be with ourselves, journaling and practicing that we're going to ask for help and then be open to receive help. I tell my kids all the time, you can't receive if you don't ask. You got to ask for what you need. But emotional self-care is very important. Spiritual self-care, how are you nurturing your soul is important. And even as teenagers, y'all know I've had some teenagers tell me, oh, Miss Ameka, I don't go for that. That's something that I don't deal with. You're going to be respectful to me. So when it comes to spiritual self-care, what are your core beliefs that guide your life? Meditation, I teach mindfulness meditation because that's a way to just quiet your thoughts and just quiet yourself and be present with yourself at the same time. And also fostering self-forgiveness. There's some things that even our teenagers, and I love them, some of our teenagers are dealing with some issues that they feel as though they can't even forgive themselves. Like, Miss Ameka, I can't forgive myself. So even helping them forgive themselves and working through those issues is important to building your spiritual self-care. Next page, please. And also social and personal self-care. So important. So it's being with other people, but also taking time to be with yourself. And you hear me say with yourself and not by yourself, being with yourself. And the personal aspect of it is learning who you are, fostering those healthy relationships, checking your circle. Because as teenagers, and my daughter can definitely say this, her circle had to change from her 9th grade year to now she's a sophomore at George Mason University. Her circle changed. Even my 14-year-old, from the time she was 11 until now she's a ninth grader at Hampton High School, her circle has changed, So there's times you may want to check your circle. Start planning some long and short-term goals. Just because you're a teenager or in school, middle school, you can still plan. You can still think about, okay, I'm interested in being in a band. I'm interested in this club. I'm interested in the governor's school. I'm interested in, being in a, in a camp, some type of camp or sports. It's okay to start planning now for activities and for your life for the future. Intellectual self-care is so important. How are we nurturing our brain? So are you reading some books? Are you reading an article? Are you trying something new? Even if it's just a recipe, looking up a recipe like, Mom, I want to try this. I want to try to put this in the air fryer and cook something. Trying something new, learning continuing to learn and grow. Those are all ways that we nurture ourselves intellectually. And also setting boundaries too, that talks about professional self-care. Even as our teens, I mean, you don't want to overdo it. So if you get invited somewhere and you want to say no, but you're like, oh my gosh, I don't want her to be mad with me. It's okay to say no. It's okay to set boundaries. You're already in 4 clubs at school and your friend told you, oh girl, come on, let's do this other club. And you really don't have time for it. And you already got 4 clubs you're already in. It's okay to say no and set boundaries. So knowing your limits, but also nurturing your brain is so important. Next slide. Next slide, please. The importance of loving oneself. This is so important. Self-love, what is it, Ameka? It is the active process of accepting yourself, caring for yourself, recognizing your worth, and encouraging yourself. Self-love all day. It's knowing that you are of value just because you are. I am of value just because I am, not because I am the captain of football team, not because I made straight A's, not. And it's okay to ask for help too. Having a support system, having a village that you can talk to, because I have to say it, parents, most of my clients I talk to, because of course it's confidential, as a licensed clinical social worker, they can't talk to parents, that they're not able to share some of the very much so information they share with me. And one of my questions I always ask during assessment, who makes up your support system? Because I want to know, who do they go to when they need to talk to somebody? And I'm so grateful that I would say 80 to 85% of my children, of my teenagers too, they have someone they can talk to. So if it's not mom or dad, they have an auntie, they have a nana, they have a papa, they have a cousin, an adult cousin. They have someone to talk to, because that's very important. Because when it comes to asking for help and support, they need to have someone that they can go to. What concerns me greatly is when I have a teenager or I have a child who tells me there's no one that they can go to. They can't talk to mom, they can't talk to anyone, dad, no one. That's a great concern to me, because I want the child to have at least someone they can talk to. Next slide. This quote is dear to me because I truly believe it. It says, no one is you, and that is your superpower. And that is so true, because oftentimes our teenagers and our young kids, they look on Snapchat and they look on TikTok and IG and Facebook, and they're always comparing themselves. Some of them, not always, but I wish I could do this. I wish this, but no one is you. And that is your superpower. That's what makes you great. So I tell my kids, strive to be the best you every single day. So don't try to be Susie Q. Don't try to be Johnny B. Try to be the best you that you can be. All righty, next slide, please. Self-love is so important. This quote touched my heart. Self-love is the highest frequency that attracts everything that you desire. Because when you love yourself, I tell my kids and my teenagers, you walk different, you talk different, you feel good about yourself because you know your value. You know your purpose, and they're just as confident. My kids that really love themselves, oh, I love to see it. I told one of my kids, she was on fire. I said, you need to get a podcast, or you need to blog or something, because she was humble, but yet she was oh so confident. She loved herself. She knew what her worth was. And it was just beautiful to watch it and see it. And she was only like 14 years old and was on fire, confidence wise. Yes, next slide, please. This beautiful flower, I love it. There comes times that we need to take what we need from ourselves. So I tell my teens and I tell my young kids that there's times that we need to seek those things within ourselves. So there's times when we're going to have to seek rest. There's times that we're going to have to lay it down and be reflective. There's times that we're going to have to seek joy. Like, what brings you joy? We can't expect mom and dad and siblings and other people to give us a lot of these things on this flower. We have to take what we need from ourselves. And I love that one of them up there, it says help. We have to ask for help. And I want to encourage my wonderful parents out there to make it inviting for your kids to ask for help. It doesn't mean something is wrong with your child when they need help. One of my kids, I mean, he was kind of discouraged, if I can share, from coming to therapy, because the first thing he told me, he said, my dad said something was wrong with me. So that's why I had to come talk to you. And so you could just imagine how therapy went with him, because he was already thinking, I guess something's wrong with me because that's what dad said, so I'm here talking to you because something's wrong with me. Nothing was wrong with him at all, nothing at all. I just think his dad had some concerns and he just needed to talk it through, so we have to be careful when our kids come to us for, or when our kids, or you see things that are in your children, talk to them about it. Johnny, how do you feel? I think your self-esteem, or I feel like there's some things that we need to work on. Tell me how you feel. He may, tell you some things that you'll be surprised to know. So make sure you take, as parents, we take time to listen to our kids. And like I said before, validate them so that they will come to us and we can have those very needed conversations about what they're feeling. Because nowadays our teens and our kids are going through so much more than what we went through when we were children and teenagers. It's a whole different ball game. Okay, so I want my parents to be more empathetic. Next slide, please. So I wanted to stress, so if I could foot stomp, that your mental health matters. So our teens matter. Some of my teens, they tell me all the time, they say, Miss Mika, I don't feel like, my feelings matter. Matter of fact, it was told to me that, I'm too young to have feelings. So my feelings aren't really, they don't really matter. And I'm the only one to let them know, no, your feelings do matter, and I validate. So I say, for this slide, how we talk about ourselves matter. Speak life to yourself, speak love to yourself. As parents, just encourage that. Encourage, positivity with your children. It's okay to direct, to discipline. It's okay to redirect when you see, negative behavior, but make sure you keep those lines of communication open, and you definitely make sure you let your child know that their feelings matter. And as I've said before, it's important for our children to know they got to be their own best friend. Something I've always told my daughters when they were younger, in order to have a friend, Lydia or Sarah, you got to be a friend. So we need to let our children know that they need to be their own best friend, because from there, externally it'll flow out. And be patient with yourself. That's something that, also for our teens and children. Life is not a sprint, it's a marathon. So learning about who they are, their self-care regimen, stress management, it's not a sprint to the finish line. It's truly a journey. And these will be things that they'll take with them. I've been journaling ever since I was 7 years old. And I still journal, at the age I am now, still journal. I've always enjoyed walking. I still walk now. So some of those things, if you just allow your children to just be patient with themselves, and as parents, we need to be patient as well and allow them to just express themselves. And most of all, I say, truly love yourself, flaws and all. No one is perfect. We are imperfectly perfect human beings, and we are all worthy. You are worthy. Okay. All right, next slide. So last month was Women's History Month, and I want to leave you with this quote from the great Harriet Tubman for all of my kids and my teens and parents. Every great dream begins with a dreamer. Always remember, you have within you the strength, the patience, and the passion to reach for the stars to change the world. Okay, next slide. Yes, this is a self-care wheel that I was talking about earlier. It has the 6 different domains. I combine the psychological with the emotional, and I love this wheel, and I have also shared with Suffolk Alumnae Chapter that they can share this with anyone who's interested in getting this self-care wheel. You may receive it because I love it. It has different ideas. So under all of these domains, it gives you wonderful ideas on things to do to encourage self-care in that area. And so For physical, it tells you to get enough sleep, to take vacations, to take time off. Psychological, it gives you wonderful ideas. Relax in the sun, read a self-help book, join a support group, and on and on. I'm not going to read all of them to you, but it gives you wonderful ideas on what to do to help balance your life, because that's what the self-care wheel does. It helps balance your life. And each one of these domains, I try to at least encourage my clients, try to do at least one activity in each one of these domains a day, if you can. Now, if you can't, 3 or 4 be great, but within a week's time, I say at least try to incorporate each one of these domains within a week's time. You can say, Ameka, when I see you in, the next session, I was able to knock out each one of these areas of the domain during this week. And matter of fact, one of my clients, you all, she was able to knock out one in an activity. She found a recipe, like a cooking a cake, and her sister got in the kitchen, had fun. She was a college kid. Her and her sister got in the kitchen, had some music on, and had a great time cooking in the kitchen and fixing a cake. And when she came back to me, she was like, I nearly knocked out all of the self-care domains with one activity. And she really did, because she enjoyed herself. Next slide. Okay, so I want to thank you all. I want to thank Suffolk Alumnae Chapter for inviting me. It was my honor to speak about a topic that is so dear to me. The one book that I love, and I've actually mailed it to some of my clients because it's such a good workbook, it is the Self-Love Workbook. The one thing I love about this workbook is that it has wonderful activities that I do with my clients, and they love it. So this is a wonderful resource by Dr. Shana Ali. And so I would encourage anyone, great resource. All righty, that concludes my presentation.
Thank you so much, Ms. Lee-Graham. I appreciate it. We're going to go ahead and open up for some questions for you. I do have some that were sent to me. The first one is, what is the best way to introduce the media detox to my team?
Okay, you said a media detox. Just first have the conversation, say, be open. Say, because oftentimes some parents, we are too on it too much. And you can say, we on it too much. I've seen you, Johnny. It just seemed like every time I turn around, you're on social media. How about we take a break? And say, how long do you think you can take a break? An hour, 2 hours? Because we need a break from social media. And I would use the word we, because oftentimes as parents, we are on it too. And so bringing the conversation with it, like how long do you think you could last without being on social media? And if they say, I don't think I could last being on social media, then guess what? We need to give it a try. Let's do an hour and start slow. You want to build, you don't want to do a weekend, right away. I would start slow. Let's see if we can put it down for an hour, Johnny, and then so I have actually done it with my child. I'm like, look, let's just get off for a couple of hours, because I'm on it a lot too. And so sometimes we need to do what we're asking them to do. So I would say, start it out as a question, and then join them, because sometimes we're on it just as much as the kids.
Thank you. That was a great response. And the last question I'm going to provide at this time, it says, while respecting boundaries, how do we address mental wellness on teens? Should we do it one-on-one as a parent, or should we automatically go to a professional like you?
I would say first, and that's a phenomenal question. Thank you for whoever asked that question. Phenomenal. I think parents need to start first. Have that conversation, and don't make it seem as though you're putting the child like something's wrong with you, or you need to talk to somebody. But just ask them a simple question. Johnny, how are you feeling? I see you sometimes and you seem sad. Are you okay? Just starting that dialogue with your child. And sometimes the kids be like, I'm okay, I'm good. They'll keep it the one word. And then you have to gently press. So are you sure you're good? Because I know with the pandemic, you don't see your friends as much. You're not in school. And just gently press, as one of my mentors told me, gently press. And hopefully they'll open up and tell you more. But I think it starts with the parent. And then guess what parents can do? Say, babe, son, do you think that you would feel comfortable talking with somebody? Because maybe it's tough talking with me. Would you feel like want to talk to someone? And be ready to receive their response, because they may say yes. And if they say yes, act on it immediately. And then ask them, okay, I thank you for being honest with me. Do you want to see a male therapist or a female therapist? Because it matters. Because some young, boys, they want to see a boy, they want to see a male, and I encourage that. So ask them those questions, and if they say no, Mom, I'm okay, Dad, I'm okay. So okay, I just want to make sure you're good because I see, you're not, leaving your room much, or it seems like you seem kind of sad to me. I just want to make sure you're okay, son, and keep your eyes open, keep watching, and if you still see a pattern of, not motivated, the grades may be, not doing well, or you see the different things that concern you, bring it up again, just you and the child, and talk about it again and say, Johnny, I think just to talk to somebody is okay. It doesn't mean anything is wrong with you, babe. It just means mom wants you to be able to talk to someone about some things that may be bothering you, and just make sure you word it like that. Like it's not nothing wrong with the child. It's just that you want him to have someone to talk to, or her to have someone to talk to. And just pose it as that. And I've had parents who have done it like that. The child will, will positively respond. But those parents who make it seem as though, something's wrong with you, and I need you to, I need Miss Graham to fix your brain. Those are the sessions that don't go very well, because they come in automatically thinking something is wrong with me and my dad or mom wants you to fix me. And I don't fix anybody. I'm not a fixer of a person. My teens and my children, they work through those emotions, and they heal themselves. I mean, they work through the process. But that's a great question. I hope I answered it.
That was a great response, Ms. Graham. Thank you so much. I'm gonna pass it back to Ms. Powell. We appreciate you again, Ms. Graham. Thank you.
My honor.
Thank you so much, Ms. Graham. It is truly, truly wonderful to know that it is okay to admit that you're not okay. And I want you guys to just say that to yourselves, because that is so, so important. A lot of times we like to hold things to ourselves or not tell other people. But part of this, when it comes to mental health, is being honest with yourselves and also letting other people know what's going on with you so they can help you. Ms. Graham just gave you guys some wonderful, wonderful tools that will help you not only as teens and adolescents, but that you'll be able to carry into adulthood, like asking for help, living a balanced lifestyle, prioritizing you, saying no, sleeping, and being mindful about each and every one of your actions. And realize that some people, they don't get this until much later in life, but you are getting it now. If nothing else, I do want you definitely to take away from this part of our presentation that you are you. There's no one that can take your place. You are very important. And lastly, if you haven't heard it in a few weeks, today, and a couple of months, I'm saying it right now in front of the whole world. You are loved. I love you. So keep that in mind. And I do want to share with you that the will that Ms. Graham shared with you, as well as a handout that Dr. Wallace had for his presentation, we'll be posting that to our website for you guys to be able to explore and to be able to start putting some of those things into practice. Again, my name is LaKeela Powell. I thank you guys for your time. I know there's other things you could have done on this beautiful Saturday, but you found it important to be with us to learn more about how you can improve in your own physical and mental health. Thank you. And again, I love you. I'll be turning it right back over to Soror Shay Skinner, who will be closing out our event for today.
That concludes session 2 of our Black Health series, the Teen Health Summit. I would like to thank all the viewers who joined us this weekend to receive the knowledge on the provided topics that are so important to our youth. Once again, if you have any further questions, please forward them to us at our website, suffolkdst.org, and we will make sure they get to the appropriate speaker. Our speakers, Dr. Brooks, Dr. Wallace, and Ms. Lee-Graham, thank you so much for your time and education on these topics and being strong resources for our viewers. You all are such strong pillars in our community, and this information is essential. Thanks again on behalf of Suffolk Alumnae Chapter of Delta Sigma Theta Sorority Incorporated. I would like to mention our up and coming May 8th event, session 3, that will be titled advocating for your health and mortality rate during delivery in Black women. We look forward to another educational event. Thank you all once again for joining us. Please feel free to join us on all feel free to follow us on all social media platforms. Have a great day and beautiful weekend.